Welcome to my channel, guys. I hope so you're doing well. I am Dr. Ria and I'm here to help you out in the medical studies. Today we'll talk about the optic nerve, its origin, termination, pathway, and finally we'll talk about the lesions of the optic nerve. Let's talk about the origin of the optic nerve. There are a ganglionic cell on the retina and their axon will combine together and form the optic nerve. So in this picture, it's basically the cells that are present on the retina. It includes rods and cones, bipolar cell, and then finally end up on the ganglionic cell. For the lateral inhibition, there are horizontal and amacrine cell. So the axons of the ganglionic cell will combine together and form the optic nerve. The optic nerve will terminate on the optic chiasma from the retina into optic nerve, and the optic nerve will end up on optic chiasma. So we'll talk about the overall pathway of the optic nerve, and the optic nerve will start up with the retina. Where the retina, there are ganglionic cells on the retina which will form the optic nerve. The optic nerve will end up on the optic chiasma. Then the optic nerve will continue from the optic chiasma and terminate on the lateral geniculate body. From the lateral geniculate body, there will optic radiation which will end up on the visual cortex. Familiar with the red and blue color, what it represents? The red color is basically the left visual field and the right sides of the eye. And the blue color represents the right visual field and the left side of the eye. So at point number 1, there is a lesion of the optic nerve. So when the optic nerve will be damaged, it will include damage to the both red and blue side fibers. So the both right and left visual field of the left eye will be lost. So the gray color in the picture is representing that the vision is lost of the left eye if the lesion is at the level of the optic nerve. If the lesion is at point 2, it means the blue fibers of the left eye are involved. It means that the right visual field of the left eye is damaged or lost. If the lesion is at point number 3, it means that the lesion is at the level of the optic chiasma. So in this case, the blue fibers of the right eye and the red fibers of the left eye will be affected. This is also known as bitemporal hemianopia. So if the lesion is at point 4, it means that the blue fibers of both right and left eye are affected. So the right visual field of both eye will be lost. And same is the case at point number 5, which is the visual cortex. Lesion at visual cortex will cause the blue fibers of the both eye will be lost. It means that the right visual field of the both eye will be lost. So that's all about the lesions related to the optic nerve. Thank you so much for watching, guys. To see such more beautiful videos, press the bell icon and subscribe for more, and always stay motivated.